Hey, this is Dr. Lil, clinical psychologist and core faculty in a graduate psychology program in Minnesota. Um, I have been doing a lot of autism evaluations lately for adults. And the first, I want to say that I think it takes a lot of courage to seek out an evaluation for autism as an adult when you don't know the type of reception you're going to get first, and second, uh, because you don't know what the results of it are going to be. I think people do an evaluation because they want to have a better understanding why they don't feel like they fit in, why they have had struggles that other people don't seem to have. And I think they want to have clarity around that, clarification around a diagnosis that might help explain some of the struggles they've had. I've had a couple recently where I've had to tell people that they don't meet criteria for autism spectrum disorder. And I think that honestly is one of the most difficult things that I have to do. Here's someone who feels like they don't fit in and who feels like they found an explanation for why. The brain is just wired that way, and they don't fit in because they're different from everyone else. And I can see why that would feel like such a validating thing. And these couple of instances, and these are some of the kind of normal things that we might look at to be able to differentiate an autism diagnosis from other things. Anxiety was a really core part of what helped explain a lot of the things they were going through. I won't get into all the patterns and everything, but and it was just a better explanation, along with some childhood trauma and struggles that really helped explain how they viewed other people as not safe and how they developed the way they did. And I think both those situations, it was a really hard piece of news for someone to hear because uh, it felt invalidating, understandably, as opposed to saying this is just the brain, your brain and the way that it was wired. Instead, I'm telling them that with trauma, this is something that happened to you that was out of your control and it's still impacting you today, which is a hard thing to hear. And in the second one, I think anxiety, people don't recognize the power that anxiety has and the significance of the biological roots of anxiety in terms of being kind of similar to autism and ADHD, kind of being there from the time that you're born. Which is the way that I look at anxiety. So, and I think they often think of it as like, well, so you're telling me I'm just crazy. Actually had people tell me that, and I don't think that's the case at all. I think there's a real struggle associated with anxiety. I think there's a real struggle associated with how trauma impacts you, and I think it's a really hard thing to hear that, and is not as clean of an explanation as autism would be. So I just wanted to share this because, man, it takes a lot of courage again to get tested and then to feel disappointed because um, you don't feel like the explanation that the evaluator gives you um, is one that really clarifies for you how to move forward or what your identity is. And I can see that as being a really difficult part of being tested for autism and getting that result. If I could give everyone some sort of neurodivergence stamp of approval to say you're different and it's okay, I would. I don't think anyone's choosing um, to struggle. And I think the struggle that people come to an evaluation with are real. I don't think people are faking. I don't think that they're trying to be something. I think often it's that they have a real struggle and they've maybe found similarities to autism, to ADHD that might help explain it. And I think the reason that I don't always give autism as a diagnosis first, we have certain criteria, ethics wise, they have to meet criteria in order for that to happen. I think the second is I want to give someone the right explanation for why they're struggling with the things that they're struggling with, so they can work on the right things as they go forward, right? anxiety, trauma. I think those are things that can be worked on in different ways than autism, even though those can also overlap with autism for sure. I want to give people the right things to be able to work on, to be able to move towards the things that they value in life. And sometimes, unfortunately, it means that you may not have what you thought you had. Anyway, thanks for listening. Just thoughts on this and the struggles that I have with, disappointing people in that way and seeing that they feel invalidated, which sucks to me because I never want to have people feel invalidated in the process of what they're experiencing. But at the same time, I understand why that can feel like a really invalidating thing. So if you've been through that, you've had a similar experience, my heart goes out to you. I know that's not easy, and I hope whoever evaluated you, if it wasn't me, it was also validating of the struggles that you have.